Data can really be very powerful if you know what to do with it, because it can influence people, it can influence systems, and it can influence change.
Being part of this action learning set around this particular subject matter has reinforced that we as kind of agents within the healthcare system have to work together to improve the data that we have. And that doesn't necessarily mean collecting more data for the sake of it, but how can we look at the information that we have already about the kind of citizens and the populations that we're looking to improve health for? How can we bring it together from different parts of the system so that it can shine a light on some of the issues we have, but also measure the impact we're having?
Working at a national level, what would be wonderful would be if there was consistency in gathering data on inequalities. Sometimes that can be quite regionally or locally based, and the quality varies and what's actually collated varies. So for a national programme to be able to actually assess who's accessing care and where we can support people so that we can close those gaps in inequalities, consistent, accurate, high quality data set across the country would be really, really helpful.
If you're working on a regional programme, it's really important to have a central pool of data, somewhere where diverse teams can come together and share their data. So one of the things that it's sort of influenced me in moving forward in my thinking and planning, and the work that HSE QI are doing, is how do we do that? We decided to start somewhere, and that was with a simple SharePoint site. So we developed a SharePoint site that all our 21 teams have access to, and it really is an open culture. So each team uploads all their data, and every other team can see it. So again, that's sort of promoting this open culture, but it's also then helping learning at pace.
On a local level, working for the Health Innovation Network in South London, it's imperative that we work with our local systems to ensure high quality data is gathered. Working in mental health at the moment, improvements are starting to be made. We have the Patient and Carers Race Equality Framework, which is going to hopefully start improving data collection, but we work very closely with our South London colleagues to gather that data and see who's missing from care and work to resolve that.
I suppose my advice for anyone starting off in improvement and using data to address inequalities really is, first of all, you do not have to be a data expert. Do your stakeholder analysis, work out who you need to connect with, and be sure of what your aim is. So what are you trying to achieve?
Consider data access from the very beginning of a project. Look at what you have available, what you could potentially access, and work with that. If the data is incomplete, then build into the project, accessing and involving population, communities, anybody that you need to, so that you can build that bigger picture.
I think sometimes we can build a picture of an issue and get caught in describing the issue and talking about the issue and shining a light on the issue, but then there isn't that translation into improvement and change from that kind of description of the problem. And so I think we need to find smoother, quicker, effective ways of moving data into action, and not get tied up in the kind of the joy of describing the issue at hand.